Hey guys, and welcome back to my channel. So in this video I'm just going to be playing a little game with you. We are taking a nursing quiz, so you can take this quiz with me. The link is down in the description box, so you can just go along with me and see how many you get right and let me know in the comment section. So every now and then I'm going to be doing these cute little games because I'm currently really busy regarding school and all of that, and these videos are the most easiest for me to fill in the gaps when I'm really busy. So definitely expect a lot more of these. If you guys have anything that you would like me to try, like some sort of nursing challenge, one of those things, definitely let me know. I'd be interested to do those. But anyway, without wasting much time, let us get into this video. So the first question says, a nurse is caring for a patient with MRSA, which is methicillin resistant staphylococcus aureus infection. So it's like an infection that you get on your skin because your staphylococcus bacteria is on your skin. So methicillin is an antibiotic. So methicillin resistant, so it's the bacteria that is resistant to this antibiotic. So you're wearing a gown and gloves, obviously, to protect yourself from catching this bacteria. When should they dispose of the gown and gloves to go care for another patient? There's usually, like in the patient's room, they will have like a red box where you remove all your PPE before you go out of the room. So in the hallway, incorrect, because you can pass anywhere in the hallway and you can touch someone or just have some physical contact of some form and you can pass it on to that patient, to another person. So you should never remove your PPE in the hallway. In the current patient's room, yes, you definitely, whatever things that you touched your patient with, they must stay in that room. So as a result, if you're wearing this PPE, make sure that like your pants and stuff are not sticking out of your apron. Your uniform must be covered as much as possible with your apron, and then you remove everything and you leave it in there. Disinfect your hands, you wash your hands, and you go out. In the break room, no, that's just putting other people at risk. So please never walk to another room with gloves from another room. That's just spreading infection from one room to another, and is really bad infection control. And then in the next patient's room, before touching them, I've already mentioned this. So the correct answer is in the current patient's room, as it lowers the chance of spreading the infection to staff or other patients. Next question. After receiving an antibiotic, a patient is developing hives. What are they experiencing? Drug allergy, possibly because it is a reaction to an antibiotic that they just received. Drug tolerance, not necessarily, and no, because drug tolerance is when you've been receiving a certain medication for a long period of time and your body is now so used to it that you need a higher dose for it to have the same effect before. So it's the same thing as you have with alcohol. The more you drink of it, the more drinks that you need to have for you to become drunk. Whereas drug synergism is when you give two medications together and the resultant effect that they have is much greater than if you were taking those medications separately by themselves. For example, certain patients will give them Panadol and Tramadol together because when those medications are together, they provide better pain relief than if you were giving just Panadol or just Tramadol by itself. So it's pretty much when you're doing a combo type of thing where two things are coming together and they provide better care or they provide better treatment than if they were by themselves. And then drug idiosyncrasy is, it's almost like a drug allergy reaction, but it's one of those that are unpredictable or unsuspected, because with most medications we are aware of certain allergy reactions that you will have, whereas if you've got a drug idiosyncrasy, it's something that is unexpected and happens in a small population. And then, so as a result, the way you would know if this is a drug allergy or drug idio, what that word is, you would check on the antibiotic. Does the antibiotic, what type of allergy reactions does it usually give to people in certain populations? And that would help you determine. So in this case, with most antibiotics, they do give you a rash or a hives. As a result, this is a drug allergy. But if it was like a really rare symptom that you're having that it doesn't normally happen with that drug, then that would be a drug idio, that word. Okay, next question. Okay, when should a nurse weigh a patient to obtain the most accurate weight? Right after eating, no, because the food you've just eaten would give you an incorrect reading. And then 2 to 3 hours after eating, possibly, because by that time usually you should have digested the food, and people with fast metabolisms, usually they would have passed it out of their digestive tract. And then at the same time every day, possibly, yes, so that it's in the same context. So for example, if you're taking it every morning, it's just after you've slept, you've digested your food, you do not have any extra weight from the day's eating and that sort of thing. Let's see. Correct. The nurse should weigh the patient at the same time every day. Most likely the patient will be in similar circumstances as the same before, as the day before, and as a result there are better comparisons to one another. Right. If a resident is suffering from chest pains, do all the following except which one? Okay, call for immediate help. Definitely. If someone is having chest pains, it's a serious thing. You definitely need to call for help. Offer support and reassurance. Definitely, because if someone is having chest pains, they're mostly going to be freaked out, which will raise their blood pressure, which also raise their pulse. And you're having chest issues, which is mostly a heart thing, and you really don't want to be raising your blood pressure and pulse in those circumstances. And then place them in a downright position and have them take small sips of water. Downright position, not necessarily because you want them to elevate their head, so that one questionable. And then remain and act calm. Definitely in all emergencies you need to remain and act calm, because if you're freaking out, you're gonna freak out your patient, and that's just gonna create a lot of more problems. So from process of elimination, the place them in a downward position sounds the most incorrect to me. Let's see. Correct. If a patient is suffering from chest pains, no food or drink should be consumed until they are assessed by a doctor, and they should also not be put in a prone position when experiencing chest pains. So prone position is when you are lying on your back, so that's bad for you because you are compressing your chest. So obviously you want to be in a supine position, which is the other way around, and slightly elevated will also help you. Okay, the food one I didn't know. When doing documentation, which of the following qualities are relevant? Documentation, this is when you're making your notes in the nursing process. Thoroughness, definitely you want to make sure that all the details about what you did and how the patient reacted to it is there. So, like for me, whenever I'm making these records, I'm always thinking at the back of my head, should I be taken to court for something, I need to make sure that I've covered my butt in this thing that I've written. So that will just help you to be as thorough as possible. And then accuracy, definitely is very important, especially with time. In nursing, we do this thing where you do a patient's vital signs at 4:30, but you write it for 5 o'clock. Please do not do that, because from the period of 4:30 to 5 o'clock, the patient's condition could change, their vital signs could change, and you've already written down that these were their vital signs at 5. So I know in most the way that the hospital structure is, people expect you to sort of do it like that, but just to save yourself, write it at the correct times, especially with your late entries that you do at the end of the day. You usually do them at like 5, but you write it for 6 o'clock. Don't do that. Just write it like you did it at 5, and don't round off the times. Don't do like you're doing it at 3 and then you round it off. You're doing it like at 3:58 and then you round it off to 4 o'clock. Those 2 minutes, a lot could happen in those 2 minutes, so just don't do that to yourself. And then organization definitely needs to be organized. You don't want to be making an entry about a patient's condition after you've taken them over from the night staff. You say, okay, they had a good day, and then you mention 2 of their vital signs. Maybe you put your blood pressure and pulse, and then you write about something else, and then you add your temperature and your respirations at the end. It must all just make sense. It must be in some form of order so that it's all collected, because you want to read about something and then read about it at the end. It just creates a lot of confusion and wastes a lot of time and space. So all of the above, definitely. And I love what they say here: documentation must leave no room for interpretation. So someone mustn't think, oh, I think she was trying to say this in the interim. You must never do that. You must be specific about what you're trying to put out to the person who's going to be reading your report. Which of the following would be the best option to decrease swelling? Heat compression, cold compression. I feel like there's a lot of what's the word there's a lot of confusion about which one to use in which context. How I try to remember it is cold compression, you use it when there's swelling, because when there's swelling there's a lot of blood flow to that area. As a result, that area is going to be really warm, so if you put a cold compression, it's going to decrease the temperature at that area and decrease the swelling. Just hold on. I'm in a room where there's motion detectors, and as a result, every time I just constantly sit here, the lights switch off. Give me a minute. And then when it comes to your heat compression, I like to remember it in this way. You use heat compressions when you've got sore muscles, and I like to think of sore muscles as being cold because they are tense and they're not moving. As a result, if you put a heat compression, you're going to increase the blood flow to that area, you're going to make that area warm, and therefore you're going to relax your muscles. So those are the differences between the two. So in this case, we're trying to decrease swelling, so the cold compression is winning currently. And then your moist bandages and your dry bandage pressure. A moist bandage is usually when you put like gauze and then there's some sort of ointment on it, and then you put it on your skin, or you put, it's usually when you put an ointment, then you cover some form of dry skin, or you're putting it on a wound so that the ointment can seep into the wound to allow it to heal. Whereas with the dry bandage pressure, it's pretty much just to to suck up the fluid. So that could either be pus coming out, blood, so it's just to stop the flow of that type of fluid. So the moist bandage and the dry bandage really don't help us in this situation, so I'm going with cold compression for our scenario for swelling, which is correct. All right, how long should a nurse wait before taking a patient's temperature orally after they just finished a cold drink? So immediately, as a cold drink would not affect the oral thermometer. No, definitely something hot or something cold is going to affect your temperature in your mouth. 3 to 5 minutes after a drink was finished. I don't know. I don't think it would take that little time for your mouth to get back to its normal temperature. I feel like it would need slightly more minutes. 15 minutes after a drink was finished. I think that would be a good medium. And then 20 to 30 minutes after the drink was finished. I feel like 20 to 30 minutes is a bit too long, so I'm going with the middle ground here and saying 15 minutes. Let's see. The oral cavity needs a little time to return to a normal temperature, and 15 minutes is enough, because you really don't want to wait a whole half an hour after the patient is eaten to go take the temperature. It just wastes too much time. What is the normal internal body temperature? 37 degrees Celsius, 37.7 degrees. I would say it's like a mild fever, and then 35.6 is still fine, so slightly normal. And then but obviously if you're going lower than 35.6, then you're going towards hypothermia, and then 38 is a fever. So I would say 37 is a good middle ground, which is correct. And then the funny thing is, in nursing, we never really learn about one specific body temperature. We always speak about ranges with everything. Like in nursing, the normal ranges would be between 35 and 37.5 degrees Celsius of a temperature. Obviously, 37.5 would be like on a hot day, and then 35 would be on a cold day. And then so it's interesting how this is just one. In nursing, usually we're just dealing with ranges, because not everyone will be smack bang at 37. It will range, obviously. What is hypertension? A medical term of high blood pressure. And as a nursing student, you really need to know these two phrases, where, for example, if you're talking about diabetes, not many people know what diabetes is. So it was obviously, when you're speaking to a normal civilian, you'd say, do you have sugar, or do you have high sugar levels? Or if you're talking about high blood pressure, obviously we know it as hypertension, but to normal people it'll be hypertension. So you definitely need to learn those type of things, and there's certain conditions where you really have to find a simpler way to say it, because not everyone is gonna know what hypertension is. Okay, so while preparing a sterile fluid for a dressing change, which of the following constitutes a break in the sterile technique? Not using sterile gloves to touch the outside wrapper of a sterilized material. So not using sterile gloves to touch the outside wrapper of a sterilized material. Usually with sterilized material, it's got two packets. So you'd open your sterile field, and let's say you're opening your sterile gloves, and then you take them out of the first packet, then they're covered by another packet, and then you'd put them on a sterile field. Or for example, you're opening scalpel, they usually be in a separate packet, and then you open up on your sterile field, so you really wouldn't need your gloves for that. And then placing the sterile items onto the sterile field, no, that will not be a break in sterility. Placing a sterile object on the edge of the sterile field, yes, that is a break in sterility, because we always assume that the outside of a sterile field is not sterile, because usually when you're opening a sterile field, you touch the edge of the sterile field when you're opening it up. As a result, we assume that the outside borders are unsterile. So that is our correct answer. What is palliative care? Improving the quality of life for an elderly patient. No, not really. Using surgery to cure a patient, no. Improving the quality of life for patients with a serious illness, yes. And 24-hour care for a patient. I mean, the 24-hour thing, even patients that are not under palliative care, they would still be under 24-hour care, so that one doesn't make sense. So the most correct one is improving the quality of life for patients with a serious illness. So in general, what we say palliative care is care for patients that are near death, or it's really serious that they might die, or it's like they've been given a prognosis by the doctor that they are going to die. Those will be patients that we qualify for palliative care. Okay, so my phone died a bit, so we just take two. So the next question says, which nerve is compressed when your carpal tunnel syndrome is present? The process of elimination, let's go with this. So your axillary nerve is the one that's in your axilla, which is under your armpit. Your optic nerve is your eye nerve, and then your trochlear nerve is, I think it's the one in your ear, I'm not sure. So by process of elimination, I'm going with your median nerve, which is correct. Carpal tunnel syndrome is a condition which causes numbness, tingling, and pain in the hand and arms. This happens when the median nerves, which is one of the major nerves in your hand, is squeezed or compressed here. Before a blood transfusion, what blood tests should be done? Okay, clotting time, yes, so that they can determine whether they need to give you blood with platelets or just blood with the plasma. And then blood typing and cross matching, definitely, because you don't want to give someone an incompatible blood, and that causes a whole serious reaction. And you need to check for infections. I mean, you would have to check, the blood would have been checked for, so it really wouldn't matter if the patient has an infection, because the blood that they're getting wouldn't have. So I think the most important one would be blood typing and cross matching. Which correct? Which of these is considered as stage 4 decubitus ulcer? Decubitus ulcer, let me quickly Google that. Isn't decubitus ulcer, isn't that the one on your buttocks? As you can see, with nursing, you love using big words. Bed sores, yes, I knew it was the one on your buttocks. As you can see, nursing loves using these words, so it's very important that you know what certain words are in like terminology, medical terminology, and like normal English. For example, micturition is peeing. You need to know that type of things. So anyway, so decubitus ulcer is your bed, so which is usually on your buttocks. So is it redness on the skin, a superficial ulcer that looks like a deep crater, an open area with redness, or an open area with damage reaching the bone, joint, or tendons? A bed sore usually doesn't reach your bone, your joint, or tendons. That would be an open wound on its own. The most correct one, an open area with redness. But it could also be a superficial ulcer. Here I'm not sure, but I'm going with an open area. The first answer that I always think of usually is the correct one, which is incorrect. Wow, okay. An open area with damage reaching the bone, joint, or tendons. Okay, the damage to the bone, joint, or tendon signals stage 4. Oh, okay, makes sense. I didn't read the stage 4 part of it. So all of them were either stage 1, 2, and 3, and 4. Okay, makes sense. Which field of nursing focuses on the utmost care of critically ill or unstable patients? Critical care nursing, like you literally gave me the word, but anyway. What is the last step in making a bed? Wow, okay, I would never expect that they would make a thing about making a bed. Okay, move the core light. That will usually be at the end. Wash your hands at the end. Metering the corners, which is sort of making it like into a little triangle thing. That would be sort of in between. Adjusting the height of the bed, usually at the beginning, so that you can make the bed at the correct height, and then also lowering it back to normal. So the last step for me would be washing your hands, because you finish touching everything regarding the bed and then you wash your hands at the end. Perfect. A 2-month-old just had a cleft lip repair done. What type of restraint would you put them in? Really, I haven't dealt with such patients, but I'm assuming since cleft lip repair done, which is like when you've got a gape here by a lip on a baby, so the most restraint is obviously they want to prevent the baby from touching there, scratching it. That would lead to infection. So the most convenient restraint, I would say, is a jacket, because you don't want their arms to be moving and touching there, because babies can't control themselves. They're always touching their face. That's how they feel the world. So I think the jacket would be the most correct one. Wow, interesting. The elbow restraint will stop the baby from being able to touch the surgical side. However, it will not stop movement to the other parts of the body. Okay, makes sense. Which of the following is not a good source of vitamin A? So vitamin A, I always remember them. They are orange. So your carrots are orange, your butternut squash are orange, and then between kale and white potatoes, none of them are red. Oh, I don't know. I don't think white potatoes are a good source of vitamin A. And I was right, and here goes the lights. Hold on. What is a medical term for burping or passing gas? Flatus, but we usually say if someone is farting, they have flatulence. So flatus sounds like the most correct. Correct. What's the most accurate way of measuring your core temperature? Measuring your core temperature rectally, probably because it's inner. Orally, no, that's more outside and affected by the weather and also what you're eating. The forehead, no, that's on the outside. Otic would be your ear. I think it's between rectal and otic because it's all inside, but I'll think rectally because it's more inside and get a better temperature. Correct. What are Korotkov sounds? Korotkov sounds, it's the sounds that are made by your heart, isn't it? The dudum dudum, if I'm not mistaken. Functional heart murmurs, no. Sounds heard in an ultrasound, no. Sounds heard while measuring your blood pressure, yes. Correct. What is considered the standard 5th vital sign? So your main 4 is your blood pressure, your temperature, your respiration, and your pulse. So we've got blood pressure, we've got our heart rate, which is our pulse, blood glucose, and pain. I mean, definitely you want to know if your patient is pain, but you can know if they're in pain if their blood pressure is high and if their pulse is high. So I wouldn't say that's a fifth one. So I think blood glucose would be the most correct. Really? Okay, I guess it makes sense. But I mean, you can determine if the patient is pain with the other one. But okay, makes sense. All these help prevent pressure sores, except which one? So giving them extra blankets. But it depends where you're putting the extra blankets, because if you're giving them extra blankets to cover themselves, that's not really helping the bed sore. But if you're giving them blankets and then you're putting them on the pressure points, which is usually your shoulders, by your knees, by your buttocks, and also by your heel, then yes, but that one is vague. Changing positions regularly definitely helps prevent pressure sores, so that one is correct. Making sure no wrinkles in the sheet, yes, definitely you must remove them, especially patients that are in the orthopedic ward. The wrinkles really irritate them, and because of the creases that it causes, it actually creates more pressure on the body. And then changing sewed sheets quickly, yes, because the friction that the body will cause with the sheets if they're wet will actually cause a breakdown in your skin, making the bed sores worse. So giving them extra blankets would not help them. Perfect. Which of the following is epinephrine not used to treat? So epinephrine is your adrenaline, which is used to increase your blood pressure. So in a cardiac arrest, in your cardiac arrest, your blood is flat. Your heart is stopping to function. So obviously you'd want to restart it again. So adrenaline would be useful in that. In a life-threatening allergic reaction, definitely you would want to use it to increase your blood pressure, because in allergic reaction you actually have hypertension, and you also want to increase blood flow to the rest of the body. In high blood sugar, your pulse is high, so you'd want to avoid giving them adrenaline, because that would increase their pulse rate. And then electric shock, your blood pressure goes down, so you'd want to give them adrenaline to reverse that. So high blood sugar, you would not give adrenaline. Cool. To avoid a back injury, which muscles should a nurse use when moving a patient from a bed to chair? It would be your leg muscles, because when you're lifting your patient, you must be almost squatting so that all your weight is on your leg muscles and not your back. When is a sterile technique used? Terminal disinfection is performed. Invasive procedures are performed. Yes, you would use a sterile technique there. Strict isolation is required, not necessarily. Which option is the best to use in Which option is the best time to use an alcohol-based sanitizer? When your hands are visibly not soiled. Yes, that's true. If they're visibly soiled, you must wash them with soap and water. When you're putting in a catheter, I would highly suggest that you wash with hands and soap, because that is a sterile procedure. And when your hands are cut and have blood on them, you definitely need to use soap and water. So when is the best option to use alcohol based? When your hands are not visibly soiled. What are antiembolism stockings primarily used for? The antiembolism stockings, they sort of create constant movement in your legs, because obviously for patients that are lying down constantly, there's no movement to their legs, so therefore there's no blood flow, and they can also now have these clots and they will cause embolism. So anti-embolisms, they promote circulation in the veins. Correct. I scored 83%. You're a true expert. Thank you guys so much for watching this video. This was cute. It was fun. Definitely let me know if you have any more challenges or any fun things that you'd like me to do that are simple to record. I'm also a student. I also have a lot of things happening in my life, but I also still want to be providing content for you guys. So let me know what else you guys would want to talk about or see me doing and that sort of thing. Until next week, Friday, 12 p.m. South African time, have an awesome day. Bye guys.